Thank you. My name is Michael Tai from Taiwan. Can I see this? Can I have my slides, please? Okay. I'm a member of EGC of Taiwan National Biobank. I also sit in the IRB of Academic Seneca of Taiwan. Next one. Okay, the Department of Health of Taiwan. Now the Ministry of Health and Social Welfare in 2005 announced a 4-year pilot scheme to initiate a biobank study, and later this was changed to 5 years. The purpose was to collect personal tissue data from 300,000 persons in Taiwan aged 30 to 70 years old, including 100,000 patients diagnosed with various cancers. So we are doing, healthy people and also the diseased people. We know, in England, you just do the healthy population, and in Japan, they do the diseased people. And in Taiwan, we try to both, to do both too. You see, make our project more complicated anyway, and then created some problem too. Okay, the entire budget was provided by the government, so we don't have to raise money. The government will just give us our money. Next one. The Institute of Biomedical Science at Academic Seneca in Taipei was commissioned to set up this population-based biobank, later known as Taiwan Biobank. Since our budget has been given by the government, therefore sometimes we refer to it as National Taiwan Biobank. 4 subdivisions within this biobank have been set up: the Medical Genetic Group, the LC Group, the Information Technology Group, and the Industrial Application Group. The Taiwan Biobank has been officially in operation since 2012. Well, the first 5 years was sort of, preparation, and then, took another 2 years to make the final decision. So actually, we just started in 2012. And there are some pictures, how we do our, recruitment. Okay, promotion to the public and invitation of the patient. You see, the first picture is where people are invited to come, to have tea or something to chat, and then we have display for people to come to pick up, flyers or whatever, and then we have public hearing. People who are interested come and they can listen to the explanation and what the project is about, and decide if they would like to participate. Next one. Well, we set up 37 recruitment centers, including 11 medical centers and 26 community hospitals. And then some picture there is how we do. We see next one. Okay, this is how we do. Okay, the first picture, second picture, third picture. You see those who have decided to take part. They sign up and they will go through this process. The physical examination and donate their tissue. For research. Next one. Well, the establishment and operations of the Taiwan Biobank are regulated by detailed legislation. It is a repository of tissue information, but is not allowed to directly carry out research. Information of the participant or voluntary whose samples are included in the biobank will link several sources of data: their national identification numbers, national health insurance system, cancer registry, and cause of death registry. Next. You see, majority of participants are female. Almost 65% of those who come forward are female, and then 35% are male. And for the age group, you can see, majority are between 50 and 59. And so far, well, until the end of September this year, we have 26,813 people come forward and decided to take part in this project. Next one. Okay, and this is there's something interesting. You see, from this chart, not too many people in Taiwan smoke, but we have so-called, native people, Aboriginal people who like to smoke and who like to chew something like, bottle nuts, a betel nut chewing, and that causes some lung problem and also some, oral cancer problem. And Biobank would like to find out, if these diseases are genetically related or environmentally, socially, behaviorally related. So, this information are also collected as well. Next one. Okay, and okay, 3 applications have been approved so far, and data has been released. There are 3 major study groups. One is about Alzheimer's, and the second one is about liver function, and the third one is kidney. Liver and kidney diseases are more common in Taiwan, and so this becomes the emphasis of our national research. Next one. And I mentioned about the Aboriginal people or indigenous people. Well, because the population in Taiwan are sort of complicated. You see, they are very diversified. They are Taiwanese people, they are Chinese, sort of, Han Chinese, they are Hakka people, and there's Aboriginal as well. And you see this picture, that beautiful dress, that is Aboriginal. Next one. And this is their, traditional dress as well as the native people. Next one. The Biobank Ethics Governance Committee, was first initiated in 2006 to oversee the operation of Taiwan Biobank. Its members are appointed by academic syndica with the service term of 2 years and renewable. The current EGC has 13 members, of which 3 are law scholars, including 1 indigenous professor, and 5 health professionals, and 5 humanities and social scientists, total 13 members in our EGC. Next. The duty of our ECG has been like this: to review the protocol of research applicants and determine to release the tissue or not, to manage the data and information of the biobank and their utilities, to ensure the safety of collected information, to regulate, control the tissue usage, and any cooperation with other tissue banks. Well, in Taiwan we have this national bank and national biobank, but each hospital, especially the medical center, established their own tissue bank, and this national biobank try to work together with this local tissue bank so that we can find out what kind of genetic disease Taiwanese people carries, and also to check the documents whenever any withdrawals take place, and to review any other issue EGC is given to govern. Next one. The current status. The Taiwan Biobank has so far collected, as I say, over 20,000 sample tissue from volunteers in the Taiwanese population. Our EGC meets 4 times a year. Besides reviewing the request to use tissue material, the meeting mainly deal with housekeeping business or hearing reports from the operation team. This team, the Biobank team, will come to our meeting as well, and first they will report, what they have done and what issue they have, they have confronted, and then we discuss. And any request to use biobank material has to go through these processes. First, IRB has to approve the protocol, and then a task force within Biobank team will review the request. And then, EGC check and votes on the request, and the last release of the material if approved. Next one. Taiwan Biobank EGC voted on, August, just a couple months ago, anyway, to set up 4 subcommittees to enhance the function of EGC. Why? Well, because some people, in Taiwan feel, well, your national bank, national biobank is trying to use us as a tool for money making. Use our tissue, our blood, and then you're going to research, and eventually you're going to make money, make a lot of money. So some people have some question about, the purpose of this biobank. Therefore, we decided that we must set up a sort of social legitimacy group to explain to the population the purpose of this biobank. You see, the purpose is for, general population's health purpose rather than to, money making anyway. So there are 4 subcommittees. Well, actually, a group of 4 people came from Taiwan to visit, UK Biobank, and thanks to Andreas, to sort of help us set up these 4 subcommittees. These 4 committees are information, technology and management, indigenous people and social legitimacy, education and international relations, ethical, legal, social issue. Well, you find, I'm sure you have question already, because the biobank team itself has LC. How come we established another LC group? Well, because they do their own thing, and EGCs, know nothing about what they have discussed, you see. And then we find it is important for us to reach the people to explain the purpose of this national bank. So we feel LC is important, education is important, and international relations is also important. And next one. Well, you see it here anyway. We hope we can, host international conference next year and inviting, some people, to come to share with us, your finding, your experience, and your wisdom, so that we can do a better job anyway. Well, as I say, there are two LC group within Taiwan Biobank. One is the LC group of the Biobank team. The other is the LC new establishment. How can these two groups work together or to amalgamate into one is something we need to ponder upon in next year. LC group, or not yet, I'm sorry. LC group or Biobank team proposed to academic syndicals IRB last year that Biobank EGC is entitled to review the research protocol of Biobank team. This was rejected by IRB. Majority of EGC members believe that EGC should not review the research protocol, but Biobank LC group felt otherwise. A task force has been established between EGC and IRB for further dialogue. Well, this is one of the issues, maybe there's some kind of conflict, and then other conflict will come later. I will explain. The Taiwan Biobank is funded by the state through academic syndicate. Can EGC ask about question, read the general operation of Biobank, such as expenditure, personal appointment, etc.? We're not too sure because we never asked anything about it. We don't know how do they hire the people and how do they spend the money. Do we have the right to ask questions about that? We are not sure. Well, EGC itself, however, has no budget or grant from the state. We have to request from the academic syndicate for special funding for any special, project. Programs are under consideration to provide continuing education opportunity to Biobank team associates and other tissue bank workers. We find this is very important. Everyone got to be informed and then to learn, the updated knowledge of biobanking, etc. Holding an international conference on biobanking has been proposed, as I mentioned, and this has been approved. I hope that some of you, will be able to come to participate and share your wisdom anyway. Ethics is concerned with how we do things. As such, we are given a task to make sure all are done ethically. The Taiwan Biobank EGC like to be a responsible body, but wonders how much and how broad we can govern. This is exactly the question we have. We're wondering, okay, maybe as a critical friend or as a biting dog, but sometimes when we bark, we are ignored, you see? So without these biting teeth, is there anything good about this EGC? I know earlier, one member asked, well, would this EGC do any good at all? We find it is important for us to have EGC, but how do we function? How do we make any difference on biobanking, research team? Next one. Oh, that's it. Anyway, creating a new era in health means all of us must work together. Thank you very much.